Can surgical clipping lead to stroke complications? Surgical clipping of brain aneurysms is a procedure that can indeed lead to stroke complications. It is important to understand how this happens. The surgery involves placing a clip at the neck of a cerebral aneurysm to prevent it from rupturing. While this is a crucial step in managing aneurysms, the procedure carries risks, particularly related to the brain's delicate blood vessels. One-way stroke complications can arise is through ischemic stroke, which occurs when blood flow to brain tissue is reduced or blocked. During the clipping process, small branch vessels near the aneurysm can be inadvertently damaged or included in the clip. This can lead to a lack of oxygen in the brain, resulting in a stroke. The risk of this happening increases with the complexity of the aneurysm's location. Research indicates that new strokes can develop in about 8 to 11% of patients within the first 24 hours after the surgery. Factors that can increase the risk of stroke include the severity of any subarachnoid hemorrhage that occurred before the procedure, the age of the patient, and changes detected during surgery through neuromonitoring techniques. These techniques include somatosensory evoked potentials and motor evoked potentials, which help monitor brain activity during the operation. Another factor to consider is vasospasm. After an aneurysm ruptures and is clipped, blood vessels can spasm, narrowing them and reducing blood flow. This can lead to a delayed ischemic stroke, which may occur days after the surgery. In addition to stroke, surgical clipping can lead to other complications such as bleeding, infection, seizures, brain swelling, and hydrocephalus. These complications can also contribute to neurological deficits. Surgeons often use intraoperative neuromonitoring to detect early signs of cerebral ischemia during the clipping. This allows them to adjust their technique if necessary, potentially reducing the risk of stroke. However, it is important to note that this monitoring is not mandatory and has its limitations. Despite these risks, surgical clipping is still considered a highly effective treatment for preventing aneurysm rupture, with success rates often exceeding 95% in many studies. The decision to choose surgical clipping over less invasive options, like endovascular coiling, depends on the specific characteristics of the aneurysm and individual patient factors. In conclusion, while surgical clipping can lead to stroke complications primarily due to vessel injury, occlusion, or vasospasm, careful surgical techniques and monitoring aim to minimize these risks. Patients undergoing this procedure should be closely monitored for any neurological changes and managed promptly if complications arise. Individual risks can vary, so treatment decisions should always be personalized by experienced neurosurgical teams. Always consult with healthcare professionals for tailored medical advice.